Hi, everyone. My name is Jeanette Tartabini. I'm a physiotherapist from EksoBionics, and I wanted to send you a quick video today to go over the top reasons on why you should incorporate a robotic device like EksoNR into your daily practice. So we all know that gait training neurological patients can be quite difficult to force those normal gait kinematics so that we can start to improve the safety and the efficacy of our patients walking in order to reduce injuries and get them a better quality of life. So how many times have you been gait training your patient and you use cues such as I need you to bend your knee more, I need you to lift at your hip more, I need you to take a longer step? And does your patient really understand exactly what they're supposed to be doing? If they do understand, do they have the motor planning available to them to actually execute those movements? And oftentimes the answer is no. So we as a profession, we need to move to a new model to help our patients to improve their actual gait kinematics to give them a better quality of life. We need to give them a tool that actually gives them the opportunity to learn these gait kinematics, as we've shown that, traditional therapy methods are not producing results in this area like we would like them to. So here are the top reasons on why to incorporate a device like EksoNR into your practice. Number one is Ekso requires patient engagement and gives you feedback about that engagement. So every single patient that you put into the device is required to actively engage. It is far from a passive tool. So when they first get into the device, they get to feel what normal gait kinematics feel like. Then afterwards, it's my job as a physio to teach the patient how to start to engage with that normal reciprocal gait pattern that Ekso just taught them, and how to start to replicate that all on their own. On top of that, I get feedback scores on the patient's performance. So I know exactly how much work the device is doing and exactly how much work the patient is doing. And that guides my cueing to get the patient more and more engaged. Number two is Ekso provides very precise gait kinematics. So on each and every step, the patient is forced into a normal reciprocal gait pattern. On top of that, they required active engagement with this normal reciprocal gait pattern, which is how we know is how you make lasting changes, right? We need the patient to be actively engaged, but we need that normal movement pattern to be able to do so. Many of our patients don't have the opportunity to get into these normal movement patterns unless we give them a tool like Ekso that's going to really help them to get into that pattern, stay in that pattern, and start to learn that pattern. Number three is decreased manual handling. So how many times have you been in a scenario with a patient that requires 2, 3, 4 skilled staff members to be able to safely stand, mobilize, or gait train a patient, right? It's very exhausting to a patient. It's exhausting to us as physios. And so with a device like Ekso, what you have the opportunity to do is Ekso will help to hold that patient up into an erect posture. Ekso will help to move the patient's legs through swing phase to get into that normal reciprocal pattern so that you have the opportunity to do what you do best, which is educate the patient on what they need to be doing to be more engaged with their walking. Number 4 is how versatile Ekso is. So when you get the device, you get a wide spectrum of software available in the device, starting with just pre-gait, right? You get some weight shifting, some stepping in place, some squatting software. As you move forward into the walking programs, each program has a different goal associated with it. So you have goals, you have walking programs, the goals are true gait training, right? That teach the patient this normal reciprocal gait pattern. It can also be used for endurance training, right? To get in as many repetitions so that we can start to make those lasting changes. You have walking programs you can use as strength training programs. You have walking programs you can use to start to assess for carryover. So you can use this device with a wide spectrum of patients, right? So if you have a patient who's very, very low level, you can start with just pre-gait, just get them standing, get them upright, start to practice some weight shifting or maybe a little bit of marching in place. If you have a high level patient that's already ambulatory but wants to improve the quality of their walking, you have modes available to start to assess for carryover and strength training. So you have the ability to challenge and accommodate a wide variety of patients from very, very low level up to your high level and everything in between. Number 5 is allow for increased repetitions and intensity. So we know from our research that in the world of physiotherapy, for a majority of our patients, we do not reach the repetitions or intensity needed to make neuroplastic lasting changes for our patients. So we need a tool that can provide that for them. Instead of being able to take maybe 30, 50, 100 steps, Ekso provides you the possibility of taking thousands of steps in a single session. So what our research tells us is that patients that did not use the device and use traditional therapy methods versus patients that did use Ekso, they were able to multiply many times over how many steps they were able to take at a higher intensity, all without increasing the duration of their therapy. So that's a really powerful tool to be able to start making the changes that we need with our patients. Number 7 is that it's portable and transportable. So if, for example, you want to move Ekso from room to room, it's very easy. You have a couple of options. Number 1, you can put it on like a backpack and carry it from room to room. You can also just put it in a wheelchair and wheel it. So it's not attached to a wall or a ceiling or anything of that nature. You can easily share it from room to room. If you're interested in sharing the device between multiple facilities, Ekso is also very easy to transport, as it can be put in the passenger seat of a car and easily driven down the street. Lastly, Ekso is clinically proven and very well researched. We have over 180 published articles about the safety, efficacy, and reliability of our device in treating patients with a wide variety of neurological conditions, such as stroke, acquired brain injury, traumatic brain injury, and multiple sclerosis. So what our research tells us is that our patients see improved functional outcome measures, that they see significant increases in neuroplasticity, and improvements in their quality of life that they did not see with traditional physiotherapy methods alone. So I hope you can see the variety and the opportunity that a device like Ekso can bring as you incorporate into your daily practice. If you have any questions, just send me an email and I'd happy to set up a meeting with you, or I can provide you information about obtaining a demonstration of EksoNR. Okay, thanks everyone. Bye.